I'm Dr. Jesse Kumar. I'm one of the consultants in endocrinology, diabetes and medicine. I have a dual specialty on the specialist register, and I deal with the science of endocrinology, diabetes and medicine together. Endocrinology is the study of hormones, and hormones are essential for daily life, and it covers all the way from, say, hormone producing organs like thyroid, adrenals, to majority of the patients who we also see are from diabetes. So all of these are hormones which regulate our health, like the insulin regulates blood glucose levels and thyroid regulates the thyroid hormones which control our day-to-day life. Giving two examples, I think the common ones are thyroid and thyroid disorders, and say one of the other major hormone problem can be diabetes, both type 1 and type 2 diabetes. And if we do take thyroid, for example, as with every endocrine organs, we look at the function of the organ, how it relates to health, what are the levels in the blood, and then we also look at the structure of the endocrine organ like thyroid under the ultrasound, whether there are any nodules, are there suspicious nodules, how we need to relate to them. And we put both of that together into practice to see how the patient feels. Some of the common things could be like tiredness, which is a common complaint with general tiredness to hormone related tiredness. And also sometimes they can present with a variety in the spectrum, either overactivity, underactivity, but it can be from normal to severe underactivity, but there could be in between where there is borderline underactivity, which we call as subclinical states or subclinical hypothyroidism, all of which need to be treated to give the optimum health to the patient. Thyroid gland is a hormone producing gland in the front of the neck. It produces hormones which we call as thyroid. We can measure them as T4. Majority of the hormone is T4, which is produced from the gland, and it gets converted to T3, which is the active form of the hormone. And it's regulated by a master gland called the pituitary gland, which hangs at the bottom of the brain. Now, that stimulates the thyroid, and thyroid gland produces the thyroid hormones, and they are held in balance. In nature, we can have a perfectly healthy gland, we can have an underactive gland, and we can have an overactive gland. And in between of these spectrums, we can have borderline underactivity, borderline overactivity as well. To give an example, as we get older, subclinical or borderline underactive thyroid can get more prevalent. And the same thing with a overactive thyroid, that we need to recognize these conditions and treat them appropriately to produce good outcomes to our patients. Take for example an underactive thyroid. It is very common and it can produce symptoms like tiredness, weight gain, feeling extremely unwell if it's very underactive. Overactivity, on the other hand, it can produce irritability, extreme weight loss, feeling unwell, heart rhythm problems. It can cause palpitations and various other things. And if it's left untreated, it can go to rarely a medical emergency like a thyroid storm. And it's extremely important to recognize these conditions quite early, and also to try and treat these conditions before they progress to a much more severe state. And all of this is related not just to the health at that state, but also in the future, like osteoporosis, general kind of well-being. So this is what we tend to do and treat. That's one aspect of the function of the gland. And then the other aspect is the structure of the gland. We all tend to have nodules on endocrine organs like the thyroid, the adrenal and the pituitary. It is important for us to look at how that nodule looks to make sure that it's nothing suspicious, and image it. That means ultrasound or a CT or an MRI scan to any of the endocrine organs and exclude any suspicious elements in it and correlate it with the function to make sure that the gland is functioning optimally. And all of this relates to future health and life expectancy in the long run. Weight is a very personal issue, and gaining weight or losing weight is personal preference. We all have an optimal weight, and gaining more weight can lead to obesity and that to type 2 diabetes. We all know about that because it is quite a problem all throughout the world. Also, on the other hand, having low weight or low BMI can sometimes adversely affect health. In regards to diabetes, if we do take it, we have newer medications which can not only control diabetes but also promote weight loss. Without diabetes, increasing weight for whatever reason can also predispose certain individuals to diabetes, heart problems, and also some kind of cancers, or what we know as malignancies can be associated with being overweight or obese. To optimize weight, we have nutrition, which is very important, exercise, which is important, and also we can look at optimizing the hormones like thyroid. Being underactive can increase weight. Sometimes certain adrenal conditions like Cushing's can also increase weight, so we tend to check for these and offer treatments as is required to optimize weight, health, and also promote weight loss. There are some newer medications like Saxenda, which are injections which can promote weight loss, but I'm also a big believer of optimal nutrition, 5 portions of fruit and veg and more if required, optimal exercise, and I believe as we get older, above the age of 40, we have to look after our body for our body to look after us. This is aging gracefully, as we all do, and I passionately believe in that, and hope to advise my patients accordingly at my consultations. This is a very interesting question. Innovation is a part of us in our life, and that's what I'd like to provide in my consultations in my clinics. And I often think, what would it be if I was on the other side of the table? What would I want from my clinical consultation? For me, it's important to have my doctor, my endocrinologist, so all of my patients in turn are connected to me. We know our patients. It's an always on approach. Nothing is too troublesome for us. Whatever our patients want, good environment, good clinical facilities like One Ashford Hospital, clean facilities, and convenient times, convenient places close to where our clients live. That's very important to us. And also there's other side of it. It's the environmental factors. Reducing our carbon footprint, we are paperless. I think the whole experience, it's a patient experience, is very important in regards to feeling optimal, to discuss freely with your consultant your concerns, not just related to endocrinology, but general health, nutrition, exercise, and periodic checks to make sure that we have optimal health in the future. So this is the core of my practice. If there are any concerns at any stage, it's just contact us at any time. See your GP, get the blood results, and we'll be happy to see you.